Um, so I know you guys have done a lot of this work too. How long realistically should a parent wait to have their kid have surgery, or do they need it surgery at all? Like, how long will you observe a pediatric patient before really realizing that there's time to intervene?
Yeah, that's the answer to that depends entirely on the specific situation for that child. So if you have a big syrinx, you need surgery now. If you have bad symptoms, if you have sleep apnea, swallowing difficulties, cranial nerve deficits, surgery sooner rather than later. We don't want those to get worse. If it's tussive, posterior headaches, that's a bit more of a judgment call. How bad are the headaches? How much, if it's an adult, it's an easier conversation. You can say, look, how much do these headaches bother you? Okay, well, it's not that bad. I can do everything I want to do, except I can't, lift. I've had teenagers who complain that they can't squat anymore. They can't lift heavy weights because of their headache. And initially, these kids often are like, no, I don't want to have a big surgery. That's not bad enough. And they'll often come back and say, okay, now this headache is really bothering me enough. Let's do this surgery thing. But for syrinx, for obvious, for neurologic deficits like swallowing problems, sleep problems, it's probably reasonable to do surgery sooner rather than later. For other things, it all depends on how severe the symptoms are, and it's a conversation to have with your doctor.
Do you ever notice, so in a patient you're observing, do their symptoms ever get better over time?
Yes, some people do have symptoms that get better over time. Our practice here for the last almost 20 years has been, if you have a Chiari, and no symptoms, no syrinx, no symptoms that are concerning, we'll see you again in a year. And if everything's still good, we see you again 2 years after that. And if everything's still good, then we see you 4 years after that. Now we're at like 7 years from the initial diagnosis. So we don't have that many people that actually stay with us for that long. But we actually studied them last couple of years and published this paper. About 3% of the children who did not have surgery initially went on to develop symptoms that needed an operation. So it's a very small number. It's not zero, so probably worth paying attention to those folks still. The number is small. That wasn't really your question. Your question, though, was how many people who have symptoms, do they go away? And the answer to that is that it's not zero, right? So some people definitely do get better with time. And if you don't have those red flag symptoms that say you need surgery sooner rather than later, perfectly reasonable to wait, and they may get better with time, or they may get worse. And if they get worse, it makes that decision to have surgery a bit easier.
Mm-hmm. So actually, I asked that question before I realized this came up in the chat, but someone asked basically that question. Do you know what maybe the mechanism might be for those patients that get better, maybe into like adolescence or young adulthood? Why would those symptoms go away?
Why do they get better? So this is going to
It's
go
conjecture,
back.
but
What's that?
It's probably conjecture, but go ahead.
I'm going to totally guess. But if you look at those, way back at the beginning of the talk, we talked about tonsil position. And, it's a bell-shaped curve if you look at everybody in the population. Well, we also know from big studies of thousands of people that the older you are, the higher up your tonsils are in your head. So I said 1% of the general population will have tonsils below that 5 millimeter mark, but 3% of children will have tonsils down there. If you get up into like the 60 to 80-year-old range, nobody's got tonsils that low. So the tonsils actually, as you grow, the tonsils seem to migrate up slowly. So the older you are, the less likely you are to have tonsils outside of the foramen magnum. So maybe, again, this is where I get to the part of, that was data, that was real, that part of the answer. This part of the answer is totally made up. It may be that your symptoms get better because the tonsils have moved up a little bit and there's a touch more space. Maybe they were just barely blocking off that spinal fluid flow and all you needed was a little bit more space, and as you grow, you get that space, things feel better. Totally made that up, but I think it's believable.
I believe you, it's fine. So there was another question I had. I'm gonna forget it. This is kind of about, I have two questions. So first, how young do you treat a patient with Chiari? So first of all, what do parents, especially young parents who are very nervous, what do they look for in their child if they're seeing weird stuff, what might lead them to think that maybe we should see a neurosurgeon specifically? And then how early do you operate? Sorry.
Yeah, I don't recall ever seeing any child for a Chiari before the age of about 2. So typically, this comes to parents' attention because of some form of developmental delay. And it's really hard to nail down developmental delay before about that age. It's you know, at age 1, kids are saying, a couple of words, right? Some kids are saying a lot more than that. Some kids are saying less. But on average, at age 1, it's 1 or 2 words. And at age 1, on average, kids are starting to take their first steps. So it's a little bit hard to detect the kind of neurologic deficits that you might see with Chiari until they're closer to 2 or 3 years of age. So I can't recall seeing any Chiari patients younger than 2 or 3. If they're 2 or 3 and they have, Syringomyelia, will operate then. And if I saw a 6-month-old with Syringomyelia, I would be happy to operate on them. So there's not a lower age limit. It's just rare for it to come to medical attention. When it comes to what are you looking for, it's the usual thing. So how well is your child progressing developmentally? Are they making good progress with speech and motor development? That's something that your pediatrician is gonna follow pretty closely. Referral is not going to be to a neurosurgeon first, right? If there are problems, the first step is going to be to see probably a rehab medicine doctor or a neurologist, or even just some early intervention, some therapy to see if that speeds things along. Because the vast majority of kids that have developmental delay do not have a neurosurgical problem.
Yeah. And then I guess on the opposite end, so when kids start to age out of being seen by you, what's the general how does that work? How does the patient go from seeing a pediatric neurosurgeon, say they're still having problems, do they transfer over to an adult neurosurgeon? How do they make that transition, or do they?
Yeah. So you've managed to hit on another one of my academic interests, and I work a lot on transition. This is a big push in pediatrics and in pediatric neurosurgery right now. What happens when you're too old to see your pediatric neurosurgeon anymore? So in general, if you're having active problems, we're not going to try to move you to another doctor, right? So if I've been taking care of you and your Chiari for years, and there's an active issue going on, we're going to work together to try to figure out how to solve it before you transition into adult care. Now that's our practice here. Everywhere is different. Some places, you can stay with the same doctor, forever. They treat adults too. Other places have the hospital or the practice has a hard cutoff. After 18, you can't come here anymore. That's totally dependent on the local situation. What you can do as a patient, as a parent, is start thinking about this process early. At age 12, 13, 14, start thinking about what adult care is going to look like for you and your parents, or for you and your child. Start thinking about the kind of things that your child is going to need to learn how to do for him or herself to become an adult consumer of healthcare as opposed to a child. And talk to your pediatric doctors, whether that's neurosurgeon, pediatricians, everybody on your care team. Start bugging them early about what's the plan going to be for when I'm 18, 21, 26, whatever it is for your local facility. Because everybody in the country struggles with finding those adult doctors to take over care. And there's not much that you as a patient can do about that. What you can do is prepare yourself and engage the pediatric providers, make sure that they're helping you get ready for that transition to the best of their ability as well.
Yeah. Would you recommend maybe meeting with some of those adult providers if they've been recommended or at all?
Absolutely. If you have the opportunity, one model would be, to see see an adult neurosurgeon, get a reference from the pediatric neurosurgeon referral, see the adult neurosurgeon, talk over the problems with them, come back and run that all by your pediatric neurosurgeon who you're comfortable with. Or it doesn't have to be a neurosurgeon, it could be a neurologist or whoever it is that you're comfortable with. See that adult provider, come back, check in, and really try to keep that pediatric provider engaged for as long as possible so that they can work with the adult provider to deliver the care that you need. Nobody does this perfectly. The transition issue is a huge issue throughout pediatric medical care. There are little things you can do as the patient and as the parent to try to smooth the road.
Yeah. Okay, so I put in a last call for questions. So first, we've noticed this is interesting. We've noticed a strong link between heat and increased symptoms in my daughter. Is there any explanation for this? Is this common with Chiari or Syringomyelia?
That is a new one for me. I cannot speak intelligently to that question. I'm sorry.
Okay, we'll bring it back on another call. And then this is about infants. So swallowing and aspirating in infants. Is that something that requires surgery? And I guess it matters what it's for. I assume Chiari.
Yeah, it matters what it's for. So if there are problems with swallowing and aspirating, what is the underlying issue?
Chiari.
If the child has a Chiari, and they've had a swallow study where you're actually seeing that the larynx is not working properly, their swallow mechanism isn't normal. That's definitely a reason to consider a Chiari decompression. That may be the problem. It may not be. That's the kind of thing in a young child who's not swallowing properly. That's the kind of surgery that I would be willing to do, even risking it may be some other problem, right? But it's significant enough and severe enough that if I get it wrong and the child doesn't get better, we'll look for other causes. But if I don't operate and the child doesn't get better and I could have helped them, then that's worse.
Right. And I'm going to ask a question that we get a lot, and everyone has a different answer, I feel like. What's the idea about going back to like sports? Are there particular types of, yeah, I know, sorry. Are there particular types of like sports that you would recommend, maybe particularly kids up to a certain age shouldn't be engaging in, or is it okay that they just go back to their life and try to have a normal life? What would you say?
So if you have Chiari and Syringomyelia, then you are probably at a higher risk for spinal cord injury if you have a significant trauma. So if you're in a car accident, or if you have a terrible collision, something like that, you probably have a higher risk for something catastrophically bad than if you didn't have that. If you have a Chiari, you might have a higher risk, but I really don't know. So in my practice, I have this conversation, right? You might have a higher risk than your peers. I don't know how much. So you have to take that into consideration as you make decisions along with your parents about whether to do these activities. I tell every patient in my practice that I think football is an inherently violent and dangerous sport, and I don't love children playing football, period. So, but if a kid with a Chiari is also a football player and wants to go back, I'm not going to tell them that they can't do it. My job is to tell them that the risk for them is probably a little bit higher, and they've got to take that into consideration as they're making their decisions. If you have a Chiari surgery and the surgery goes well, and you're 3 to 6 months out from surgery, now theoretically things should be safer for you, right? Ideally, we've given you now the like normal anatomy, so you shouldn't have higher risk than your peers. So I definitely don't restrict the activity of somebody who's recovered from a Chiari surgery. Again, if you have Syringomyelia, things are a little bit different, but in general, my answer to that question is yes, your risk is higher. I don't know how much higher. Keep that in mind as you're making decisions. Wear a helmet and wear a seatbelt.
Good point. Someone says swimming. Yes, I read your bio online.
Everybody can swim, no problem.
That does kind of bring up one more question that I just want to ask, just because I don't actually think we've had this come up. What about an association, because I'm making this up, between Chiari and concussion? And could concussion make Chiari worse? Could it make